big advocate of this, and when I looked at the luxury tax, I'm thinking, are you ridiculous? Are you seriously joking? They're like, no, this is a literal tax. I'm like, no, there should literally be. I've gone to many gas stations, and what do you always see in the male gas stations? Condoms, right? They have condoms there. I don't know if it's in the female side. Is it in the female side?
Yeah.
Yeah. So that they're willing to do. Yeah, they're like, yay! But when it comes to something that's actually important, they're like, no. And I'm like, why? And that's one of the big things I'm always looking at is the aspect and the advocacy of menstruation health. Because one, this is so important. Because again, we're not in a developing country anymore. We're now able to say, yes, we can practice all this. We can educate on all these different things because one, it is not a taboo. It is something that is normal, that is happening within the body. So cultural beliefs may have purifying traditions for mothers who are at birth, as well as the placenta. Some cultures actually practice eating the placenta. Some people are like, oh gosh, that is weird. Again, those are different practices that are different from the Navajo people. We're like, oh, good night, no. One, it's considered that one, it brings youthfulness, it rejuvenates, it does all these things, it revitalizes, it brings me back, everything else. There's a lot of stem cell, all these different things. But again, these are the practices of other people. So one of the things we have to learn to do is be able to say, okay, that's what you practice, all right. Okay. More power to you. All right. But a lot of times what do? We're like, it scares us, right? Because it's very different. It's very different from us. Anything that's different from us, it scares us. And that's the reason why we have these different classes. That's the reason why I try to shock you and you're like, what? Ooh, oh. So then when you see it, you're like, nah, he covered that. I'm good. Don't worry, it's one of those things. So now, within that, you have cultural variations and methods for easing the birth. Within that, you have abdominal massages and herbal teas. So you have massaging of the stomach, herbal medicines to cope with pain. Midwives give instruction and encouragement. Symbolic symbols are used, sometimes even the phallic, sometimes even the aspect of a birthing mother, all these different things. And then you have healthy birth practices. So let me click on these. So let labor begin on its own. So actually I don't need to. So if you have this, you can click on them individually. Yes?
For those that you don't know, the placenta is the one that you push out after the birth.
Yeah. So if you go back, let's see where we at. Alrighty. So this is the placenta. So it's almost like the last portion. Right?
Yeah, it's usually about that big.
So within that, imagine, again, that's one of the things is some cultures actually practice that, of eating that. And you're looking like, that's...
I thought it was weird when like my cat ate its own placenta.
Yep.
I was like, what?
Yeah.
So it looks like the sheep's liver, about that big. Push out the last one.
That's one of the things is I'm trying to make it so normal to where you're just looking at, okay, if it happens, I'm not going to be so shocked. I'm not going to be so scared when that happens. I'm not going to freeze. Because one of the big things with counseling, you always have to try to just look at it and say, you know what, it's just another day at the rodeo. Seen it all. Nah, I'm good. Yeah. That's one of the things you're always looking at. Right there. Okay. So now, the cultural variations and methods for easing the birth. So you have emotional and social support. That's one of the big things you're always looking at. Social and emotional support for parents. On the reservation, sometimes it's not always easy to have what? Both parents available. And I've actually heard, and I know I'm going to call them out, which is horrible, but I've heard traditional practitioners say, yes, you have to have mom and dad. That is the only way you can have a stable home and everything else. I said, wait a minute. I said, I've met a bunch of amazing individuals that were single parents. I said, that's a reality. I've met great individuals that literally adjusted to what situation they were at. But one of the things you're always trying to meet people where they're at. You're not trying, say for example, if you're a single parent, you're giving birth, is it the right time to start blaming them and say, why? How come he ran away? How many on that side would think that's a good time? You think it's a good time? I don't think so. No, it's not a good time because the person is literally in that unique emotional state of, I am having a baby, and everything else, the world's exploding around me and everything else. And then you're coming along as a counselor. How come you're not coming, how come this child's coming into not a two-parent home, but a single-parent home? And the mother's looking at you like, what? Now? Now is I heard this from my mother, from my grandmother, and now you, who is a counselor, now? No, not a good time. Because one, you're trying to make sure that you offer emotional and social support. It's big. Why? Because a lot of times, a lot of individuals, if they are a single parent, how many believe they actually feel like they're alone in this whole process? Yeah. Yeah. They feel like they already feel shunned from who? Mom, dad, family, religious cultures, all these different things. And now they're in this unique situation, sometimes even for the first time in their lives. And they're in that moment of, oh gosh, this is scary. I don't know.
That's when the postpartum kicks in.
That's when the postpartum kicks in. That's when you start looking at your life and thinking, did I fail at something? Did I do this? I thought I did everything right, but now this is happening. So that's where emotional and social support kicks in. That's where you're saying, okay, no, I'm here. As a counselor, I'm here. I'm available. You're working in the clinic. How many are going to be working in public health or the clinical field? So if you're going to clinical field, that's one of the big things you're always looking at is saying, okay, how can I approach this individual with compassion and empathy? That's the reason why we have individuals in psychology try to teach these classes. Because we try to make sure that you're able to say, okay, because I have, and I'll call her out on this. I have an individual that I know, amazing individual, works in the clinical field, very, how'd you call it? This, and this, that's it. That's how their mentality is. This is medical, this is how we're going to approach it, and we're going forward. And within that, we give life, we save lives, and everything else. If we lose them, then it's probably a failure on your end. It's like, oh, okay. Let's approach it a little more softly. Let's come from this angle of compassion. What do we need compassion for? We're going to get paid at the end of the day. Let's not ever throw that up there. Let's try to come from a different angle of compassion. They're like, why? Clinical is very cold. Not necessarily. That's the reason why they have us teach it. Because when we try to teach the emotionality of things, we try to make sure that you're all in touch with your touchy-feely side. Medical use of epidural is seen in developed countries. Birthing positions, upright, semi-sitting, half reclining. Within that, you have umbilical cord may be cut and tied. Placenta delivered through various methods. Within that, you have neonatal, which is in your book. So you have a chance. All the information's right there. So now, is the baby healthy? Complications of childbirth. Birth trauma can happen. So you have anoxia, which is what? Oxygen deprivation. These are where you're starting to implement a lot of the terms. So now you have diseases, infections, or physical injury. That's where we look at domestic violence. That's one of the big things I'm always looking at. If, say, for example, a person is in a domestic violence situation, I always tell them, one, to get out of that situation. And there's a reason why. Because, say, for example, and there's been numerous studies that have been conducted on that. So one of the big things is, if you are in a traumatic situation and you are a mother who has trauma and who is in a domestic violence situation, guess what? You have stress hormones going through your whole body. Whole body. Boom, 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 boom. And if you have a baby, guess what? Those same stress levels that are going through your body, now going through the baby. So now when they're born, guess what? They become very hypervigilant, have high levels of anxiety, have heart arrhythmias, all these different things that can happen for the baby. Why? Because their levels of stress are very high, just like the mother. That's the reason why I always tell mothers, if they're in that situation, get out of that situation immediately. But sometimes they're like, no, I'm going to stay for the children. No, you're putting yourself and also your children in danger. So it's one of the big things I'm always a big advocate for. And then you also have low birth weight babies, which fall into two categories. You have preterm and stage, small for date. That's what it is, not stage, but small for date. So preterm is initially the baby who is birthed primarily 3 weeks prior to the initial birth. So a lot of times mothers are given a due date, everything else. So that's a preterm baby. So they're a preemie. A lot of times they're a little smaller, everything else. And then you have a small for date baby. So initially within that, when they are birthed, their weight and everything else is very tiny. So they did go through the full term, everything else, but initially they're too small for that given day. They should have been a little bigger. That can be very dangerous as well. That's when a lot of times they're put in an incubator, right here. A lot of times that is necessary. Because one, it controls that. And then also, if there is drug use, and we will go through that, if there is drug use, it will impact the child. If the mother is addicted to meth, it will impact the child. If they have, let's see, if they have contracted some type of STI, gonorrhea, chlamydia, syphilis, if they have HIV, that can impact the child. If they are addicted to different substances, opioids, if they're addicted to alcohol, you have a SIDS baby. And so within that, it impacts the child. All of this can be, initially, when I talk to parents, when I tell them about the impacts, I always try to make sure that they're aware of all the different impacts and also the environmental impacts, as well as the societal impacts, as well as the socioeconomical impacts. Because one of the big things you want to make sure is, as they're bringing this child into the world, are they fully prepared? And I'll ask the question. So, how many couples do you think are literally, or even had a talk about what was going to happen when the child is birthed? How many do you think of those parents actually had a talk? Or was it kind of just like, surprise? Yeah. A lot of times it's just like, surprise, we're having a baby. And it's like, wait, what? Because what happens when that is happening, a lot of times it becomes very stressful. Because one of the big things is for parents, I always ask them, I said, did you talk about how much leave you have? Or all these different parameters, or do you have enough room for diapers and this and this and this and this? Because Enfamil is about $32 right now. Little tiny containers. So if you're going to go the route of, say for example, if you have a colic baby, a baby who's allergic to milk and everything else, so what's going to happen is you might end up having to use what? Use a bottle versus breastfeed. So one of the big things is, if you're using Enfamil, that's $32. And if you have, and we talked about, I think in my 241 class, we were talking about the aspect of minimum wage jobs on the reservation. I was asking about Denny's, how much they charge. How many knows how much Denny's charges, or how much Denny's charges their waiters? Anybody know?
How much they charge and how much they pay?
How much do they pay them actually?
It's like $3.
Mm-hmm. And then the rest they have to make off of what?
Tips.
Tips.
How much?
$3. $3.25 actually. How many are literally able to say, yeah, I can make a living off of that? I'm one of those individuals who were like, when I found that out, I'm thinking, that is ridiculous. And I said, you guys have enough money to pay them higher? But they don't think so. But within that, you have these different parameters that I always try to tell parents about, all these different areas of things they should be aware of, because if they're not, what's going to happen? It's going to be overwhelming, it's going to be highly stressful. That's where you have all these arguments happening. And one of the big things I'm always looking at is communication. And when I teach individuals, I'm always teaching about communication. What is effective communication? How to have effective communication with your children, all these different things. And we'll go over that eventually in this class, but one of the big things we're always looking at right now, necessarily what we're doing right now, which is looking at the biological and the genetic outlook and everything else. So now, PKU. So if you look on there, phenylketonuria, ketonuria, there you go. So this is a condition where it was impacting a lot of kids. 50 years ago, it was impacting a lot of individuals. And then you have hypothyroidism and galactosemia. maple syrup disease, which is for the galactosemia. And then you have different types, type 1, type 2, which we'll go into. So type 2 and 3, if you notice down there. And these are all happening for children. So, if you notice, risk for hypothyroidism is what? Chromosomal disorders. So that can be Down syndrome. That's where you see their different impacts. You notice the different features, everything else. That's where you have kids who are developmentally delayed. And when I used to work with kids who were developmentally delayed, it was one of those things where you had to make sure that they were taken care of. In addition to that, you had to make sure that all the different parameters were for their safety at all times. So low birth weight. So if you're looking at birth weight, this is what you're primarily looking at. So less than 2,500 grams, which is roughly about 5 pounds, 8 ounces. That's a very, very light baby. So I'm looking, what would be 5 pounds? So this is 1 quart, 33.8 fluid ounces. Who's good in math, or who's good in... So a pound, this is roughly probably less than a pound. You get a little more, everything else. But one of the things is 5 pounds, 8 ounces. That's pretty impactful. Why? Why do you think it'd be impactful for the baby?
Because its bodily functions are still maturing, or
Yeah.
trying to get strong.
Exactly. So for all of us right now, what can we all do? I want you to be able to be breathing your air, everything else. You can breathe on your own. You're like, oh, I can breathe. For a very small baby.
Oh, the gimbal there.
Yeah, they can't hold air. Everything is still developing, and it's not fully matured. Then you have very low birth weight, less than 1,500 grams. So again, this picture is there for your viewing. So you have low birth weight, you have average weight, which is 6 pounds, 9 ounces. That's good. Which then goes up into the 7 pound range. Some of us are probably a little bigger, right? I know I was. I think mine was in the 11 pound range. I was born by C-section. Yay! Exactly. It's like, okay. Then others, probably a little smaller and everything else. It was like, okay. But then you have extremely low, less than 1,000 grams, which is less than 3.4 pounds. That's scary. It's a very tiny baby, a very light baby, all these different things. So now what do you think is going to happen? Are they going to stay in the incubator? They have to, right? The fear of baby going home with mother, or with parents, it's a very real fear. So now, low birth weight, cause for low birth weight. Developing countries, malnourished mothers, and lack of prenatal care. That's one of the big things is looking at prenatal care, you want to make sure that you're covering all these different areas so that as they're going along, they're not smoking and they're not drinking. I've had some individuals who are like, well, you know, I kind of have a beer here and there. It's all right. I turned out fine. And I'm looking at them like, really? Come on now. I don't really believe that. Of course, I'm using my clinical judgment, so I'm like, no. And then developing countries, what is happening? Cigarette smoking. Because a lot of times they're thinking, oh, you know what? It keeps my weight down. It's a good thing that allows me to lose weight a lot quicker. And I'm thinking, no, that's a baby. That's not water weight. That's literally another human being. And then you also have multiple births. So these are individuals who do not allow their body to recover. Because one of the big things is, and I met a lot of individuals when I was working with domestic violence, I met a lot of individuals who went through this route of multiple births. The reason why is the male individual wanted to have an initial power and control over the mother, so what they would do is constantly get them pregnant. So after they were birthed, everything else, the next thing is a lot of times it came down to the aspect of jealousy, so they were like, no, I don't want anybody to look at you, to see you in any way, therefore I am now going to give you another baby. I'm thinking, wow. So that's very dangerous for the baby and for your own health. And they're looking at me thinking, but I've given birth multiple times. Yes, but you're not allowing your body to recover. That's one of the big things you want to be able to allow your body to recover. And then you have maternal age. So maternal age ends when? For individuals to have a baby, healthily. Come on, men.
45?
40. So at the age of 40, after the age of 40, it becomes very dangerous. For who? The mother and also the child. So when they start having menstruation, what is that showcasing? The menstruation, if you look at it, and I think we went over that, did we go over that last class? We went through the whole aspect. I don't know if you look at the video, if you look at your PowerPoints, it has the whole, outlook. I don't know if you guys remember that. Week 2. So week 2, it goes through the whole outlook of all the different health concerns. If not, I would advise to look at that. That's where I have the video uploaded to, and it kind of goes step by step all the different things that you're looking at. But one of the big things is maternal age. That's where a lot of female individuals are advised to, one, that's where they talk about the window. You have a certain window of time to what? Have a healthy baby. So from the first time you have what? Menstruation, that now is signaling to the biological world, and also from an evolutionary perspective, you're looking at saying, okay, this is the time when your body is now ready. You have enough eggs, everything is healthy, you have now a given window and a set time to start having babies. So within that, that's that given window, all the way up to the age of 40. After 40, it becomes a little more concerning. Because one, after 40, there are the possibility of various risk factors. And then drug use. So now, low birth weight, high mortality rate, low birth rate for small to date infants, poor maternal malnutrition, low birth weight for preterm neonates, inadequately developed physical symptoms. So again, their body is not able to fully develop. In addition to that, you have immature lungs, immune system, and their central nervous system is not fully developed. So that's one of the big things is your central nervous system is the thing that runs up through your brain all the way through. That's the thing that gives you all the input and everything else that allows you to stay awake in this class, that allows you to function, that allows your heart rate to go and everything else, that allows you to say, okay, you know what, I ate earlier and now I can feel my stomach moving and everything else. Oh, good night. It's all these different things. That's your central nervous system at work. So now, rates of low birth weight around the world. That's in your book right now. So now, low birth weight. So treatment for low birth weight infants include kangaroo care. So skin-to-skin contact. That's one of the big things you're always looking at. Skin-to-skin contact. The reason why is if there is no skin-to-skin contact, it becomes impactful for the child because the child is not able to initially attach itself to anybody else. And then infant massage. But again, they're still at risk for they're at risk developmentally or developmentally maturing. So newborns, they look like old men. This is my water, right? Okay. So the average baby born is 20 inches long and weighs 7.5 pounds. Firstborns tend to be lighter than laterborns. Boys tend to be slightly heavier and longer than girls. Sorry, that's just how it works. You can say, nope, I don't believe in that. I don't want to accept it. No, 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 no. Then you can have an argument with the medical community. Have fun with that. So the first few days, the neonate will lose about 10% of its body weight. But then later on, by 5th day, that's one of the things you're trying to allow them to bounce back. But that's if everything is happening perfectly in that home. That's if everything is following accordingly. If there's abuse, guess what? It spikes. If there's all the different parameters that are happening, it all spikes. So this is what I'm looking at. So 1 minute after delivery, and then again 5 minutes, they're going to utilize what's called an APGAR test, or APGAR scale. Within that, infant's score may be affected by the amount of medication the mother received. So, let me see if it's on here. Nope. So this is the APGAR scale. It threw everything off. No? Okay, well, it's still readable. So the APGAR scale. So I am going to, there it is. I'm going to have you go to, yes. Okay. Hold on.
If you write
All right.
anything on your computer, you need to get Grammarly.
I write pretty much all day.
The APGAR score was invented in 1952 by anesthesiologist Virginia APGAR. It is a scoring system ranging from 0 to 10 and is calculated by evaluating the newborn based on 5 criteria. Each of these criteria can be allocated a score from 0 to 2, and then the sum of these criteria will give you the total APGAR score. In the original article published by Virginia APGAR, the original components of the score were color, heart rate, reflex irritability, muscle tone, and respiratory effort. However, there is an easier way to remember these criteria by remembering the mnemonic APGAR for appearance, pulse, grimace, activity, and respirations. Typically, the APGAR score is calculated at 1 and 5 minutes after birth. If the score is low, you usually repeat the score later. A score of 7 and above